How do biomarkers predict future stroke risk? Imagine a simple blood test that can tell you if you're at higher risk of having a stroke in the future. That's what biomarkers do. They are measurable substances in your blood that reflected what's happening inside your body, especially processes linked to stroke. These biological indicators can reveal early signs of problems before any symptoms show up, helping doctors identify who might need more attention to prevent a stroke. Biomarkers are like biological flags that signal changes in your body. They can point to issues like inflammation, heart stress, or blood vessel damage. For example, N-terminal-proB type natriuretic peptide, or NT-proBNP, is a marker that indicates stress on the heart. Elevated levels of this marker are strongly associated with stroke risk, especially in people with irregular heartbeats like atrial fibrillation. Another important biomarker is growth differentiation factor 15, or GDF-15, which is linked to inflammation and oxidative stress, both of which can damage blood vessels and increase stroke risk. Cystatin C is another biomarker that measures kidney function and overall vascular health. When kidney function declines, the risk of vascular problems and stroke can rise. Interleukin-6, or IL-6, is an inflammatory molecule that indicates systemic inflammation, which is a key factor in the development of atherosclerosis, or clogged arteries. Lipoprotein, A, is a type of lipid particle that promotes the buildup of plaque in arteries, increasing the chances of blockages that can cause strokes. Research shows that combining multiple biomarkers into a panel makes predicting stroke risk more accurate than relying on just one. This multi-marker approach captures the complex biology behind stroke, including heart health, inflammation, and blood vessel integrity. When these biomarker results are integrated with clinical risk scores, like the CHA2DS2-VASC score used for patients with atrial fibrillation, doctors can better determine who is at low, moderate, or high risk. This helps guide decisions about preventive treatments, such as blood thinners, to reduce the chance of a stroke. Studies across different populations, including Black and white groups, suggest that biomarker-based risk prediction works broadly. However, ongoing research aims to validate these models further and make them more reliable for everyone. In practical terms, blood tests for these biomarkers can help doctors differentiate between types of strokes, such as ischemic or hemorrhagic, and even identify transient ischemic attacks, which are warning signs of a future stroke. In prevention, biomarker panels can identify people at high risk before they experience symptoms, allowing for early lifestyle changes or medications. While promising, these tests are still being evaluated for routine use in clinics, and more research is needed to standardize their application. The future of stroke prediction may involve advanced analytics, like machine learning, to interpret complex biomarker data and create personalized risk profiles. In summary, biomarkers predict future stroke risk by revealing underlying biological changes linked to stroke mechanisms. When used alongside traditional risk factors, they improve our ability to identify who might benefit most from preventive strategies. This approach offers a more detailed picture of individual risk, helping to tailor interventions and ultimately reduce the number of strokes. Always remember, if you have concerns about your stroke risk, consult with a healthcare professional who can interpret these tests in the context of your overall health.